Reprise débat d'un Parliament Secretary to the Minister of Finance.
Thank you, Mr. Speaker. I want to begin today by telling you about a child who is sick, whose parents have been told there is a real promising treatment that isn't yet available in Canada, not because it doesn't work, not because it isn't safe, but because the paperwork hasn't caught up, because the system wasn't designed for that child in mind. As a father of 3 beautiful girls, I couldn't imagine the sense of desperation that parents would be in that moment. But I definitely feel an imperative to support this bill and to do everything we can to prevent parents from having to go through that in those life-changing moments. This is the problem my colleague from Thunder Bay Rainy Rivers trying to solve through this private member's bill C-265 and is proposing to fix. So I'm proud to rise today in strong support of this bill brought forward by my friend and colleague, who is an ER physician and a member of this House who understands, I think, better than most of us, what it means when a patient's time starts to run out. This is not a partisan issue. This is about whether we are ready to put patients first, empower clinicians, and help reduce barriers to saving lives. Mr. Speaker, I bring a particular lens to this bill. I've never been a physician, of course, but before coming to this House many years ago, I spent time working in medical research ethics at the University of London, St. George's Medical School, where I helped to oversee more than 500 clinical trials and research projects. And I have sat in review meetings, I have read the research protocols and pored through the applications. I've seen what it takes for promising treatments to move through the system, and more importantly, how long it takes. I know what rigor looks like, and I know what evidence-based medicine looks like, and I can tell you with confidence, this bill does not cut corners. Instead, this bill cuts red tape. And those are 2 very different things. I've also seen the other side. I've spoken with families who were told to wait, who were told to be patient, who watched their loved one deteriorate while a treatment that might have helped sat across a border or in a regulatory queue. That experience stays with you. It's why I wholeheartedly support this bill, and it brought me here today to this chamber to say we can and must do better. Mr. Speaker, let me describe what our current system looks like in practice. A doctor, let's say a pediatric oncologist in the world-renowned Sick Kids Hospital in Toronto, has a 9-year-old patient. She has a rare form of cancer. Her family has exhausted the standard treatments. Her parents are desperate. And her doctor knows about a treatment being used successfully in, say, Europe. It's passed clinical trials abroad. It's being administered to children just like her in Germany and France, in the United Kingdom, but not yet approved here in Canada. So the doctor goes through the special access pathway, and she fills out forms. She waits. She follows up. She waits some more, she follows up some more, and weeks pass. And this child, in that time, is getting sicker and sicker. Now picture the same scenario at Princess Margaret Cancer Centre in Toronto, one of the top cancer hospitals in the world. Their specialists are seeing the same thing, cutting-edge science at their fingertips, but bureaucracy stands between the treatment and the patient. This is not hypothetical. This is happening right now in hospitals across the country. Delays are holding up access to life-saving medication. And the impact is not just medical, it's financial and emotional. Families are spending their savings traveling abroad for treatments, in some cases that are available only elsewhere. Parents take unpaid leave. Siblings grow up in the shadow of a crisis. Our system has the power to ease, but hasn't yet. Mr. Speaker, what does Bill C-265 actually do? I want to break this down in plain language as I understand it, because this matters to every Canadian, not just those who work in medicine. Right now, if a doctor needs to access a treatment that isn't yet fully approved in Canada, they have to navigate a slow, complex, case-by-case process every single time. Bill C-265 changes that by creating a pre-approved list of therapeutic products for special access. Think of it as a curated catalog of treatments that have already been vetted, already been shown to work in other rigorous health systems, and can be accessed more quickly when a doctor determines a patient needs them. Think of it like a pre-cleared lane at the border. The work has already been done, the safety checks are already being run. When a doctor needs to act, especially in an emergency, they shouldn't have to start from scratch and can use their clinical judgment to determine what treatment is in the best interest of the patient. And critically, the safeguards are there in this bill. This bill does not allow just anyone to access any drug just anytime they feel like it. The health minister retains the ability to restrict access for specific uses and specify limitations on practitioners and the settings for those usages. The minister can add new products and remove any of them the moment safety concerns arise. The integrity of our drug approval system is also protected. This does not allow Big Pharma to circumvent Health Canada's rigorous regulatory approval process. The bill gives the minister the ability to, on reasonable grounds, ask a manufacturer of a therapeutic product for an explanation if they suspect they're trying to circumvent the regulatory approval process, and can remove that product from the list immediately if the reasons that are given are deemed unsatisfactory. The bill also brings real transparency to this process. There will be a public list of approved products updated regularly with annual reporting on access timelines and outcomes. Both practitioners and manufacturers will be required to report. This is accountability built right into the heart of this legislation, not as an afterthought. Mr. Speaker, one of the things I love most about this bill is that it trusts doctors to be doctors. We train our physicians for over a decade. We put them through the most rigorous education and examination in the world. Then in the moment of a medical urgency or emergency, we ask them to stop and file paperwork and then wait. While lives hang in the balance, they should be empowered in those moments to do what they do best. Imagine if we asked a firefighter, Mr. Speaker, rushing into a burning building to first complete a request form before grabbing the hose. Bill C-265 empowers physicians to use their clinical judgment, especially in emergencies, while still operating within clear, accountable framework. This bill includes another important provision for the health minister to issue letters of authorization for emergency access to new drugs. This is for emergency situations when a patient's life is at stake, and the letter of authorization would be used by weighing the benefits and risks to the patient if the drug is used and if it's not used, along with all available medical evidence. In any cases where the information available may not be conclusive enough, the minister can grant authorization if two practitioners who are expert clinicians with specialized knowledge agree that the use of the therapeutic product is in the best interests of the patient. And if requests are denied, this bill requires written justification of the minister's decision. The bill also outlines limitations on the minister's ability to refuse a letter of authorization and includes an emergency hotline to help practitioners access this process at all times. This means no more silence, no more wondering why. It means greater transparency for doctors, transparency for patients, transparency for families. Mr. Speaker, let me give you another example of why this matters. Rare diseases are by definition rare. There may be only a few hundred Canadians living with a specific condition. Because the market is small, pharmaceutical companies don't always prioritize getting approval here first. They go to the United States, they go to Europe. Full approval in Canada comes years later, if at all. So a parent in Halifax or Saskatoon or right here in Ottawa watches their child suffer knowing that a treatment exists, has been proven, is being used right now in other countries, but cannot be accessed here. That parent is not asking for miracles, they're asking for fairness. They're asking for their child to get the same chance a child born in another country does. Bill C-265 gives Canadian patients that fighting chance. It says, if the evidence is there, if the international approval is there, we will not make you wait while the system catches up. Now, I want to take a quick moment to recognize that it took a lot of work to get this bill to the floor in the House of Commons. Our colleague, the Member of Parliament for Thunder Bay Rainy River, didn't write this bill on the back of a napkin. He consulted extensively. He talked to patients, families, physicians, emergency room doctors, oncologists, specialists in rare diseases. He engaged with legal experts, with ethicists, with regulatory professionals. This is what good legislation looks like. It is built from the ground up, shaped by the people who live with these consequences every single day. I also want to acknowledge the patients and advocates that push for this change. Kudos to you. This bill belongs to them. Lastly, Mr. Speaker, I want to close with this. Good health policy is always a balance. We want to be rigorous. We want to make sure that we give the Canadians safe, proven, and accountable medications. We also want to be compassionate. We want to be fast enough that the system doesn't make the decision for the patient before the doctor even gets a chance.